Hello everyone, welcome to my speech therapy channel. I am Neetu Kaul and I am a bilingual speech language pathologist. In this channel, I would like to educate the parents and caregivers of children and adults who have speech and language disorders. In this chapter 1, I would like to focus on introduction and case scenario child 1. By speech, we mean the clarity, the quality, and the fluency of the sounds, words, and phrases produced by an individual. When the child has a speech disorder, it's usually difficult for the listener to understand him or her. By language, we mean the expression, the comprehension, and the literacy skills. A typically developing child is able to express herself by combining words or using gestures, is able to understand what's being said to her, and has age-appropriate reading and writing skills. If not, then the child may have a language disorder. We say speech language disorder when both speech disorder and language disorder is present. Speech and language disorders exist because of congenital causes, acquired causes, or unknown. Congenital means that the child was born with this disorder. Maybe the child was born with hearing loss or syndrome. Acquired means when the child or individual develops this disorder after the birth, maybe due to infections, trauma, or the child was not exposed to language-enriched environment. Most of the time, we don't know the cause, so it's unknown. Let us say that our child 1 is nonverbal, may or may not use gestures, cries to express his or her needs, has difficulty understanding routine commands, or has a delay in age-appropriate skills. What needs to be done? First of all, we got to know the developmental milestones. Developmental milestones are what a typically developing child does as she grows. I have included the link. Please refer to the cdc.gov link, Center for Disease Control and Prevention link, and educate yourselves about the developmental milestones of a typically developing child. Yes, we do not want to compare our child with others, but we have to know these milestones because we want to know what to expect next, what skills we need to focus on. For this child 1, we'll focus on play activities and parent and child interaction, joint attention, word production, and understanding simple commands. How would you support your child? You could help your child to learn a skill by repetition, multiple repetitions. Your child needs to hear you repeat the names of the objects, simple commands in order to learn. If you want to teach the name of an object, say pen, you could use the name multiple times as I have a pen, my pen, your pen, red pen, small pen, big pen, pen on the table, pen under the table. So keep on repeating. Second is motivate your child. If your child makes an attempt to say something or uses gestures, praise your child. You could say, I'm so proud of you. Wow, that was great. Good job. You could give her a hug. So motivate your child. Always follow a fixed routine. Provide feedback to your child. You could record his or her activities or gestures and play back to your child. Let her see how she is doing. That could give her biofeedback. Remember, everyone in the family could help. Also, child would take time to learn, and remember to use the language you are fluent in or comfortable with. Make sure to avoid asking questions. Usually when we are speaking with our child, we ask lots of questions. What are you doing? What do you want? Can you tell me this? Do you know? Say this. Say something. Who is she? Can you say your name? How many cookies do you want? Whose pen is this? So we need to avoid asking questions. For this case, the child 1, we would focus on pretend play. However, some children do not like pretend play, so you should always ask your child's speech language pathologist for advice. Now moving to pretend play. Pretend play is the imaginary play, and it's usually very important for the development of language skills. During pretend play, we want to choose the activity that our child likes to do. If the activity is of child's interest, she may be able to interact. Pretend that you are giving a bath to your child's favorite toy or stuffed animal. Use a small bowl, small towel, and pretend that you're bathing the doll or the toy. Then use the towel to dry her face, arms, legs, and we want to make sure to use simple vocabulary words such as bath time, soap, water, done, dry hands, dry hair. Second activity could be pretending that the toy is brushing her teeth. We could use crayons, 2 crayons, or we could use small brushes and a small toothpaste. We can pretend that one crayon is a toothbrush and the other is a toothpaste. We want to make sure to use simple vocabulary words such as brush, nice, all done. Make sure we're not asking questions. Pretend that the toy is hungry. We could prepare meals and feed breakfast. We could make lunch. We could prepare dinner and feed the toy. And while we're doing that, we want to make sure we are using simple words like breakfast, pancakes, bread, cereal time. Show pictures of food and tell the names. Or if you have food objects, you can use those, or you could also use the real food. We could pretend that the toy is thirsty. Pour water in a cup using a flask and make sure to use simple vocabulary words such as water, thirsty, cup, flask, more water, give me. We could pretend that the toy is using utensils. We could put food on the plate and make sure to use simple vocabulary words such as eat, spoon, fork, plate, yummy food. Pretend that the toy is playing. We could pretend that the toy is playing on the slide or playing with the ball or blowing bubbles. And we could use the words such as we kick ball, throw ball, catch the ball, blow bubbles, pop bubbles, my turn, your turn. Pretend to have a tea party with the toy. Use small cups, plates, teapot, food, and use words give me, tea, cookie, bread, more please, yummy, yummy. You could also make sandwich, take 2 slices of bread with cheese in it and use words bread, cheese, my turn, your turn. Pretend to have a birthday party. You could use a picture of a cake and candles and words such as blow, cut, eat cake, give me please, yummy cake, I'm full. You could use these words. Pretend that the toy is singing nursery rhymes. Maybe Old MacDonald Had a Farm or the Finger Family song. Make sure you sing the song. Child and parent interaction is a must. Sing rhymes for your child. Maybe your child will be able to imitate. Pretend that the toy wants to color. You could take crayons and draw pictures. Say, draw a picture of an apple and then color apple. And you could use simple vocabulary words such as, wow, I see an apple, red apple, Nice. Yum, yum. Pretend that the toy wants to sleep. You could have a small blanket, cover the toy with the blanket, and sing songs, sing a lullaby. Make sure to use simple vocabulary words. Sleep time, blanket, good night. Pretend that the toy is sick. The child could be the doctor. And you could use words, she is sick, coughing, cold, medicine. Check eyes, ears, mouth, tongue. This way you're also working on the parts of the body. Pretend that the toy is buying groceries. The child could carry a bag. Make sure to use words such as buy milk, buy ice cream, potato, tomato, apples, pear, bread. Pretend that the toy is selling hair accessories. The child could have some fake money. Make sure to use simple vocabulary words such as I want hairpins, hairband, comb, brush, money, here, thank you. You could also connect with parents who have the child with a speech and language delay. They could share their own experiences, they would be able to provide support, and they can share the strategies that work for them. Thank you.